Hello, and welcome to part 4 of the law lecture entitled Care Transitions. During this lecture, we will define care transitions, discuss medication reconciliation, discuss the need for medication reconciliation, discuss the evidence supporting pharmacist involvement in medication reconciliation, discuss the role of the pharmacist in medication reconciliation, discuss common barriers to medication reconciliation, and discuss the foundational concepts for care transitions. Care transitions can be defined as the movement of patients between healthcare locations, providers, or different levels of care within the same location as their conditions and care needs change. It involves the patient, family, nurses, social workers, pharmacists, physicians, and other healthcare professionals. The most important part of the pharmacist in care transitions comes in the form of medication reconciliation. Medication reconciliation is the comprehensive evaluation of a patient's medication regimen anytime there is a change in therapy in an effort to avoid medication errors such as omissions, duplications, dosing errors, or drug interactions, as well as to observe compliance and patient adherence patterns. This process should include a comparison of the existing and previous medication regimens and should occur at every transition of care in which new medications are ordered, existing orders are rewritten or adjusted, or if the patient has had non-prescription medications added to his or her self-care. According to the Joint Commission, the medication reconciliation process consists of 5 steps. The first is development of a list of current medications. 2. Develop a list of medications to be prescribed. 3. Compare the medications on the 2 lists. 4. Make clinical decisions based on the appropriateness of the comparison. And 5. Communicate the new list to the appropriate caregivers and to the patients. Other associations have further simplified the process of medication reconciliation into 3 easy steps. 1. Verification, 2. Clarification, and 3. Reconciliation. The goal of medication reconciliation is to obtain and maintain accurate and complete medication information for a patient, and use this information within and across the continuum of care to ensure safe and effective medication use. Medication reconciliation should be performed when the patient undergoes either a transition of care between care settings, which is either an entry or admission or a discharge to or from the hospital, ambulatory care setting, or long-term care facility, or achieves a new level of care within a setting, or a change of care location in a setting, or a change in care providers. The other need for medication reconciliation is to prevent medication-related problems. In recent years, numerous studies have demonstrated the need to address medication-related problems and improve patient safety through medication reconciliation. The evidence for this need includes approximately 1.5 million preventable adverse drug events that occur annually as a result of medication errors at a cost of more than $3 billion per year. Also, the average hospitalized patient is subject to at least one medication error per day, and adverse drug events account for 2.5% of estimated emergency department visits for all unintentional injuries and 6.7% of those leading to hospitalization. Other recent studies have demonstrated that the pharmacist's involvement in medication reconciliation during care transitions result in improved patient outcomes and an overall reduction in healthcare costs. Results of large medication reconciliation studies indicate that 36% of patients had medication errors at admission, of which 85% originated from the patient's medication history. Pharmacists provided medication therapy review and consultation in various settings resulted in reduced physician visits, emergency department visits, hospital days, and overall healthcare costs. And finally, medication reconciliation reduced discharge medication errors from 90 to 47% on a surgical unit and from 57 to 33% on a medical unit of a large academic medical center. Now you may be asking yourself, What is the role of the pharmacist when it comes to medication reconciliation within a care transition? Well, pharmacists have a pivotal role in collaborating with other healthcare providers to ensure that an effective process for medication reconciliation is in place and is used to successfully reduce medication-related problems across the continuum of care. To fulfill this role, pharmacists should lead the design and management of patient-centered medication reconciliation systems and educate patients and other healthcare providers about the benefits and limitations of the medication reconciliation process, and serve as patient advocates throughout the transition of care. Pharmacists must work in an interdependent fashion with pharmacy colleagues, hospitalists, primary care physicians, and other healthcare professionals in a wide variety of circumstances to facilitate communication among healthcare professionals, to support safe care transitions, and to ensure bidirectional flow of medication, diagnostic, and laboratory information for patients. Finally, pharmacists can consistently and effectively provide medication reconciliation for patients during a care transition by using a standardized approach to service delivery that is consistent with those services specified in federal legislation and regulations. Common barriers to consider when designing and implementing the medication reconciliation process within your patient care setting include insufficient standardization of data elements in the medication record or list, need for adoption of the standardized medication record and sharing of appropriate information by both patients and healthcare professionals, and the lack of established best practices when it comes to medication reconciliation. The final idea I would like to discuss with you when it comes to care transitions and medication reconciliation are the foundational concepts developed by APHA and ASHP. These two organizations published these concepts in their article Improving Care Transitions, Optimizing Medication Reconciliation in March of 2012. They came up with 8 foundational concepts to improve care transitions. Foundational Concept 1. Medication reconciliation is a key process required to improve patient care and outcomes in care transitions. Foundational Concept 2. Medication reconciliation is a patient-centered process focused on patient safety. Number 3. Medication reconciliation requires an interdisciplinary, collaborative approach. 4. Medication reconciliation must be based on a culture of accountability. Number 5. Medication reconciliation should be a standardized process. Number 6. Medication reconciliation requires coordinated communication. 7. Medication reconciliation requires integration of health information technology systems and solutions. And finally, Concept 8. Medication reconciliation requires a process of continuous quality improvement. I want you to keep in mind these foundational concepts as you move out into pharmacy practice. With the new accountable care organizations, these concepts need to be put to practice to promote medication reconciliation and proper care transitions. This concludes our lecture on care transitions and optimizing medication reconciliation. Now what you need to do is on the Moodle forum, post your answer to the following question. What role do you see for the pharmacist when it comes to care transitions with the new accountable care organizations?